you're right. For years, many believed that if you had arthritis, you shouldn't exercise because it might damage your joints. But now research shows that exercise is an essential tool in managing arthritis. And here to help us do just that is Ty Timms, exercise specialist. Thanks for joining us, Ty.
Sure.
Now, one of the most important things to remember is that arthritis is not just a factor of getting older.
That's true. And though it hits men and women, 40 and above mostly, it really can't hit any age group. Arthritis itself is a degeneration of the cartilage within the joint and can become very painful. And though that condition is never really going to go away, you can manage it.
So show me how we manage it.
Okay. The best thing we can do is do a lot of joint motion, a lot of flexibility, a lot of strength. We can start with things like just wrist circles, over and then up and down. You can go to the shoulders, do a lot of real big circles, trying to keep functional ranges of motion. As you go down the body, doing things like just rotating the knees and the hips. This is a lot of motion in all joints down there. It really works well. Another thing you can do, if you have a chair, a bench, you can sit and do what I call sit to stands. Very functional exercise, reaching out, shoulders forward, and standing straight up. You're using your hips, using your back, and using your ankles. Coming back down, doing the same thing, and do repetitions of those, and that will strengthen up a lot of the body.
Like a squat, but not so hard on your body.
Exactly. Very low intensity, low impact.
All right. Well, what are some other things that we need to keep in mind?
Well, when you're managing this type of disease, what you really want to do is you get yourself into an exercise program, check with a physician for sure, and make sure that everything that you're doing doesn't have any limitations. You can use heat and cold. You can use some bracing for different types of joints that will make them feel better. And there's some medications that you can use, non-steroidal, anti-inflammatory drugs that work really well.